and welcome. If you're on the chat and you can hear me, just put it on the comments. Let me be sure we are together. If you can hear me, put it on the chat, please. And do well to tell us where you are joining us from. So please put it on the chat if I'm audible. I want to be sure we are together before we start. And thanks for joining us. In the meantime, you can check the chat for the information that I have there. Just check out the charts I've put so far so that you understand why you are here and what this program is all about. And if you have any questions, drop them. So once we start, I'll respond to the questions as I see them. So you can read all the charts so that you understand the whole essence of this program. Okay. All right, Rana, you're welcome. Rana from India. You're welcome. So am I audible? I want to be very sure that I'm audible. So let me know if I'm quite audible or if there's any adjustments I need to make. Okay, so I'll soon be done with the charts so that we'll start. Okay. So we already have some people online. I want to know where you are joining us from, and welcome to today's live. So it's going to be a very friendly chat. So we're just here to do a friendly chat, and at the same time, I'll give you some basic information that you need. It's possible that you are here for yourself, or maybe you have a family member that you need to get some information from for. So I'm here to provide information, but I need to be sure we are together. So I've only seen one introduction, so I can see more people. We have more than that number here. So just tell me where you are joining us from. And if you have any questions, just drop it on the chat. We'll soon kick off in the next 60 seconds. In the next 60 seconds, we're going to start. It's going to be a very interesting discussion. And I'm excited to do this because information is everything. And if people can get the right information, their actions may turn out to be what it shouldn't be. So I'm here to provide the right information for you from the perspective of an expert so that you'll be able to take decisions based on that. You'll be able to advise people around you based on that. So I may be wondering why infertility. How are we discussing infertility? The reason is simple. Today is World Mental Health Day, and the emphasis this year is on people in crisis situation. Most times when we talk of crisis, we think of maybe wars and things like that, earthquakes, and people in that kind of situation. But then we forget that there are some crises within families that most times people tend to overlook, and those things are not managed. And you may not even know that those people are going through any form of crisis anyway. So, and infertility is one condition that can lead to crisis in families. So, although the emphasis this year is on other forms of crisis, I wanted to narrow it down to people who are facing this kind of health crisis, which is not just a health crisis, also a mental health issue causing dysfunction in so many families. So that's what we are here to tackle. So if you are just joining us, just put in your questions on the chat. This is meant to be a session where I will provide answers to your questions. You know, people usually say that medicine is the most worked profession. But then within medicine, I think infertility is the most worked aspect of medicine. That's where you find almost everybody doing one thing or the other. You find tradomedical, you find spiritual healing, you find all orthodox healing. So because it's a major issue. So most times you have a lot of misconceptions and a lot of inaccuracies in management. A lot of people tend to do some of the things that ordinarily they wouldn't have done because you know they're under pressure and it's a whole lot of suggestions here and there. They end up taking the wrong decision. So, and that's what I'm here to do. And I want to put up a disclaimer. It's already on the chat that this is not a consultation. It's not a scientific session either. I'm just here to provide factual information in the way the public will understand. So I'm not consulting and also not delivering a lecture. So I will just take it with the framework. I already have a framework here, but at any point that I see your questions, I'll answer any question that comes along. So if you're just joining, putting your question on the chat, tell us where you are joining from. We're starting in the next 5 seconds. In the next 5 seconds. All right, so let's start now. Okay, so you are all welcome. I'm Dr. AC Ezeke. I'm a consultant gynecologist practicing in Abuja, Nigeria. So I'm also a medical communicator and a public health scientist and a member of the WHO FIDES network. So I'm doing this as part of my work with the WHO FIDES group. When we talk of FIDES, FIDES means trust, credibility. That's where that word came from. It's actually the name of a Roman god that has to do with trust, fidelity, credibility. So what we do within the FIDES network is to share credible health information, credible and accurate health information, and also to debunk myths and misconceptions. In fact, that's one of the reasons why I'm here. So if you have any of those questions that have been bothering you, just put it so that we tackle it as we go along. And like I mentioned, this is in commemoration of the World Mental Health Day, because infertility also causes mental health problems. So that's why we also want to look at that. Although most times, sometimes it's subtle, as far people don't even want to talk about it, but yet people talk about it, sort of. So, and that's what we are here to tackle. So it's not just a medical condition, it's a condition that affects every part, whether financial, family life, career-wise. And because of the stigma associated with it, most women sometimes feel withdrawn because women take the brunt of it. You know, sometimes people blame them, maybe it's because of their past lives and all that. So, but these are the issues we'll debunk today, because infertility doesn't have to do with the woman only. It's a couple issue because it takes two to tango. So we'll be looking at it that way. We'll be looking at the couple, not just at an individual. And we'll try as much as possible to look at the causes, how diagnosis is made, the treatment. And for those who are just joining, it's just a friendly discussion. It is not a consultation. So if for any reason you have this or you have someone in your family, the person will still need to go and see a doctor or his doctor to for consultation. I'm just here to provide factual information. And I'm also here to provide solace for anyone going through this. Just know that it's not the end of life. There's always light at the end of the tunnel. So even as we start, my prayer is that God will help us and help me and help you listening to me. And those who still listen to the recorded live stream when it comes live, that people will get factual information, be able to take actions, and whatever it is that may have caused the condition, that God, in His infinite mercies, will bring a solution, even as physicians and doctors do their own part. So that's a way of introduction. Like I said, I already have an outline. So as I go through the outline, try as much as possible to share your own questions so that we also go through that. So the first thing is, what is infertility? What is infertility? Now, the way we define it, and I want you to listen very well, is that is a state in which a couple is unable to achieve pregnancy after 12 months of regular unprotected intercourse. I want you to get this definition very well. The inability of a couple, not of a woman, a couple, to achieve pregnancy after 12 months of regular unprotected intercourse. Are we together? So you should encourage me through the chat so that I'll be very sure that we're together. So that's it. So we're talking of 12 months. We're not saying that it's 2 months, after 2 months, after 4 months. No, it has to be 12 months. That's 1 year. So what it means is that before you ever say that a couple is having issues with fertility, they must have spent up to 1 year living together. Not when maybe one partner is living in another town and visits once in 3 months. No. If they are living together, having regular unprotected intercourse for 12 months, and they did that and they were not able to achieve pregnancy, that's what we call infertility. Now, there are some conditions under which this definition is modified, like when you have a woman who is older, 35 and above, or when you have someone with already a known cause of infertility, maybe somebody already known to have something like polycystic ovarian syndrome. Meanwhile, I did a live on polycystic ovarian syndrome. That was 3 weeks ago. So you can check the channel and get the live if you want to know more about that so that you can watch it. And meanwhile, if you are here and you are yet to subscribe to this channel, try and do so now so that we can get to the next milestone. You know, we are doing this live because we were able to cross the milestone of 50 subscribers. If you don't get to 50, you can't do a live. So, and some people took us from 0 to that. So if you want to take us to the next level so that people will continue to hear our voice, then try as much as possible to subscribe. So when you have a woman 35 or older, or someone with already a known cause of infertility like PCOS, or maybe the person had a surgery on a reproductive organ, or maybe the husband had a surgery on a reproductive organ, then for these people, we can consider that diagnosis after 6 months. After 6 months of regular unprotected intercourse. So it's not enough that maybe you just got married or you have someone around you that just got married. Then after 4 months, you are getting worried, trying to go and see doctors. And most times, people out of impatience start some of these processes so early, and they may end up in the hands of the wrong people. What usually happens most times for, if you are in Africa, is that most times people tend to patronize those that don't actually know. Some of them, not even doctors sometimes, they patronize people that use unorthodox medicine, alternative forms of management. Sometimes they patronize people who claim to be doctors but are not. So you find out that before they finally get to the hospital, they must have wasted a lot of money, a lot of time. And sometimes some people may have actually gone into serious health challenges due to the medications or whatever they were taking wherever they went to. So, and that's why you need to know the right thing. So after 12 months, if there's no problem, after 6 months, if there's a known cause of infertility. Now we have two major classes. Can have class 1 that we'll call primary infertility. Then we'll have secondary infertility, that's the second class. Primary is when someone has not conceived before, the person or the couple, they've never conceived at all. Then secondary is when maybe they were able to conceive before, then after some years, after some time, it didn't happen again. That's what we call secondary infertility. For those of you joining from Africa, most times secondary infertility is more in Africa. As we go down, we'll discuss some of the issues that cause infertility. So primary, no conception before. Secondary, there has been a conception, but then it didn't happen again. That's what we call secondary. Now, when we talk about the causes, like I mentioned when I was starting, I say it takes two to tango. So we don't just look at the woman and say, no, she's the cause. Maybe it was because of what she did before she got married, because of her, maybe she was wayward before then. No. That's why most women face a whole lot of stigma, because people usually attribute the problem to them alone. No, it has to deal with both. Sometimes the problem may come from the wife alone, sometimes from the husband alone, sometimes from both. And in some cases, in about 25% of cases, 20 to 25% of cases, the cause may not even be determined at all. You do all the tests and you find the cause. That's what we call unexplained infertility. And meanwhile, I have some articles. I will share the links on the live. 2 articles on infertility. They are patient education articles, so you are feel free to access those articles and read them. I will share the links later. So for women, the causes, what are the causes of infertility? Now, we discussed this looking at the reproductive organs. We have the womb, that's what we call the uterus, that carries the baby. We have the fallopian tubes on both sides that are like hands on both sides of the womb. Then we have the ovaries that produce the egg. Then we have the cervix, that's the mouth of the womb, where the baby passes through, the sperm passes through, so through that. Then we even have the brain. That's where most of the hormones that control the ovary come from. So for infertility to happen in a woman, some or all of these organs may be affected in one way or the other. So let's look at the ovary. Ovary is that part of the woman that produces egg. And sometimes under some certain conditions, it may not be able to. So what are those conditions? The most common one is the one we call polycystic ovarian syndrome. Like I mentioned, I did a live on polycystic ovarian syndrome 3 weeks ago. So you check it on the channel, you'll find the video there. Now, polycystic ovarian syndrome is a condition where some women produce more male hormones than female hormones. They are born that way. It's not because of their lifestyle. No, some people are just born that way. So, and because of that, their ovaries, they don't produce egg as frequently as those who don't have it. Now, a woman is supposed to produce at least 1 egg every month. A woman in the reproductive age group, that's between about 15 to 49. At least 1 every month. And this usually happens more before the age of 35. After the age of 35, women start getting older, so ovulation may not be as frequent as it used to be. We'll discuss that anyway. So polycystic ovarian syndrome is one disease that can make that not to happen every month. And Let me also mention this, that the egg lives for just 24 hours. It's not as if when it's produced, it now stays there forever. No, it lives for just 24 hours. So if for any reason the sperm doesn't meet it within that period, it just dies off and you have to wait till the next month. So most times when people talk about the number of months they've waited, they're actually talking about 24 hours, 24 hours, 24 hours, 24 hours each month, not the whole 30 days, because that's the only time that it can happen. Then things like age can also make the ovary not to produce egg the way it should be. Like I said, when a woman gets to 35 and above, the ovary starts getting old. So the number of eggs inside it, we call them follicles actually, they start reducing because every month a number of those follicles are recruited. We call it recruitment. Maybe about 15 of them may be recruited to form the egg. And if for any reason pregnancy doesn't happen, those 15 they've gone, they can't be replaced again. So it keeps going down because a woman is born with all the follicles, all the eggs that she will ever have in her life. So it keeps going down every year. That's what usually happens. So from 35, it may not be that much again. So that's another thing that can cause ovulatory problem. Then some also may have that problem, maybe because they had a surgery on the ovary, or maybe they received some drugs, like the drugs they use for treatment of cancer. Some of these drugs can affect the ovary. Even some diseases like autoimmune diseases can also affect the ovary, affect the function of the ovary. And also radiotherapy, if they received radiotherapy is a form of treatment for cancer. If for any reason they receive radiotherapy close to where the ovary is, that may also affect the function. So these are the things that may cause ovulation not to happen. Remember, we were just talking about ovulation. Then from the ovaries, we now move to the fallopian tubes. For the fallopian tubes, there are just those two tiny tubes on both sides of the womb. That's where fertilization occurs. That's where the sperm meets the egg for fertilization to occur. Now, sometimes these two may be damaged because of maybe previous pelvic infection or even previous surgeries or things of that nature. If it's damaged, it gets blocked. What it means is that the egg cannot come in and the sperm cannot come in for both of them to meet. And if both of them cannot meet, then fertilization will not occur. And if that doesn't occur, pregnancy will not occur. So that's also one cause of infertility in women. We're still talking about women, we'll still get to men. Then when you get to the womb itself, having things like maybe a fibroid, not all, I have to specify, I have to explain this more. Now, whether a fibroid will cause infertility or not depends on so many factors. It depends on where it is, the size, whether it's blocking the tubes, or whether it's affecting where the baby will attach later. So what I'm trying to say is that it's not always when you have a fibroid that it causes infertility, but it may cause infertility. So maybe one day we'll have a live on fibroids. That one is a big issue that we need to discuss as well. Then other things in the womb, like when you have something we call adhesions. Adhesions is when maybe after an infection or maybe someone that had an abortion and maybe had a procedure to remove the baby, the walls of the womb gum together. Now, this gumming together is what we call adhesions, and it may prevent pregnancy from happening. So that's about the womb. Then we have other things that may happen outside the womb, like people with endometriosis. Endometriosis is a condition in which the lining of the womb implants outside the womb. Now, what this leads to is that it may damage some things, maybe damage the ovary, damage the fallopian tube, and may cause all the organs to gum together. And this affects conception. And also other things that may happen in the brain. Remember when we started, I said even the brain any problem in the brain can affect fertility because the hormones that control the ovaries, they come from the brain. So if you have any problem like a tumor in a part of the brain we call pituitary gland, it may lead to high prolactin level. That's the hormone that comes from that place, and that may affect ovulation. Or if for any reason those hormones from the brain are low. Now, the major hormones from the brain, we have the follicle stimulating hormone, we have the luteinizing hormone, we have prolactin. And if the follicle stimulating and luteinizing hormone, if they are low for any reason, that means they won't be able to stimulate the ovaries to produce egg, and that may lead to infertility. Or when you have other problems like thyroid, we know thyroid is that gland that is in front of the neck. If you have a thyroid problem, maybe the hormones are high or they are low, any one of them, it can also lead to problems with ovulation and problems with fertility. Now, for the men, usually what we usually hear about when they go for tests, or you hear something like low sperm count, or maybe there's no sperm at all, or that. Now, a whole lot of things can cause this. We usually classify them into three. We have the ones we call pre-testicular. That's anything happening ahead of the testis. It's the testis that produces egg, just like we have the ovary in the woman. Now, we have pre-testicular. We have testicular problems coming from the testis itself. Then we have post-testicular. Now, pre-testicular are usually those problems that come from the brain, because just like in women, you have hormones from the brain controlling ovulation. You also have hormones from the brain in men that controls the production of sperm. So if for any reason those hormones are low, or maybe they have a thyroid problem, like in women, or any other problem coming from the brain, that can affect the production of sperm by the testis. Now, if they have problems from the testis itself, now some men are born like that. Maybe they are born with testes that are not very functional, or maybe for any reason they had a surgery, or they had an infection on it, we call it orchitis, or they had one that we call torsion of the testis, maybe along the line the testis twisted and the blood supply was cut off. Those things can cause the production of sperm in the testis to either reduce or even stop completely. Now, that's one cause of infertility in men. Then we have the one we call post-testicular. Now, in this case, what it means that the testis is functioning well, it's producing sperm, but then there is a blockage from where the sperm is produced to the outside. So if there's any blockage along the path that it will travel, then that means even when it's produced, it can't come out. That's what we call the post-testicular. Now, there are a whole lot of other factors that can affect even the production of sperm from the testes, like excessive alcohol consumption, smoking, taking hard drugs. There are some people with chronic illnesses, maybe sicknesses like kidney diseases and things of that nature. Even obesity, when people are obese, are too fat, it can affect production of sperm, it can affect the production of egg. These are some of the things we discuss when we get to the treatment. So what it then means, looking at all these things we discussed, that for you to make the diagnosis, you have to check both the man and the woman. So you can't just isolate just the woman to check. So they have to come as a couple. So if for any reason you are here or you are standing in for someone, always tell them that they need to visit the gynecologist as a couple. And it's always good that when they do that, let them follow up with the visit. Sometimes some people come in, maybe you ask them to do some tests, they may do just one of them, and the next time you see them is 6 months. So, and maybe you now start afresh again. So that's usually more costly, because some of these hormonal tests, you may need to, if maybe they were done a year ago, you may need to repeat them again, because the body keeps on changing every month. So that's why if you come in for evaluation, it's always good to come in prepared and make sure you get all the evaluation, all the things you need to do, get them done at once, and both partners must come. That's how it's done. So now, how do we make the diagnosis? Now, I've discussed all the possible places where this can happen, all the possible organs that can be affected. So the diagnosis means trying to check all these organs to know whether there's any problem with any one of them. So what we usually do is, for the woman, We try as much as possible to assess whether the tubes are open. And how do we get that done? We do a test that we call HSG, hysterosalpingogram. It's a form of X-ray of the womb. So it shows both the womb and the fallopian tubes, whether they're open. And there are other modern methods of getting this done. Like there's another one we call HICOSI, hysterocontrast sonography. So it's a form of scan that uses a contrast that can also be used to check whether the tubes are open. And in some cases, after doing all this, you may still need to do further tests, like the one we call laparoscopy and dye test. So that's a form of pinhole surgery that you use to inject a dye. You inject a dye into the womb and see whether that dye will be able to pass through the tubes. So to indicate whether the tubes are open or not. But this is not done in all cases anyway. So, and some people also may decide to start with it, but usually we start with HSG or HICOSI to check whether the tubes are open. Now that's about the tubes. For the ovaries, you have to do hormonal tests. So we do a lot of hormones, both the ones coming from the brain, the ones coming from the ovary, like luteinizing hormone, follicle stimulating hormone, prolactin, and the ones coming from the ovary, estrogen, estradiol, and all that. Then if there is need to check other organs like the thyroid, and we also do that. And all these tests are just to know how the ovaries are doing, including progesterone also, to know how the ovaries are doing. That's for the ovary. Then there may also be need to do a scan to check the organs, check the womb, check the ovaries and other organs to check what they're doing, how they're doing. Now these ones are for the female. Now for the man, the very first test is to do a semen analysis, that's sperm count. Now this gives you the total count of the sperm, tells us the number that are moving, then tells us the number that have normal forms. Normally, if it's 15 million and above per male, we consider it to be normal, 15 million and above. Then for the ones that are progressively moving, there are up to 40% that are moving, because usually, unlike the egg that doesn't move, the sperm moves. It has a head, it has a tail, so it swims. And if it cannot move, that what it means is that it won't be able to swim to the fallopian tube. So we usually check the number that are moving, and like I mentioned, it has to be 40 and above, those that are progressively moving. Then 4% and above should have normal shape. 4% and above should have normal shape. So that's the first test for the man. So if all these ones are okay, you may not need to do any further tests. But if they're not okay, like this semen analysis, you may need to do other tests for the man, like checking the hormones coming from the brain, to check the level of the male hormones like testosterone in the man, to be sure that he has enough male hormones. Then to do a scan, sometimes I may need to do a scan of the testes to know the size and how it's functioning. And even sometimes an X-ray to check, there's something we call vas difference. It's the tube that carries the sperm from the testes to the outside. So it's also good to check it to be sure that the vas difference is open. Or if it's not open, what it means that the produced sperm cannot be transported to the outside. So after checking all these things, you now decide what to do. Sometimes there may be further tests, like for the woman, assuming you do a scan, or we suspect that she has what we call adhesions, as some people also call it synechia. You may need to do a test that we call hysteroscopy. Hysteroscopy is a form of test that you use a camera to check the inside of the womb, the lining of the womb, to see how the cavity of the womb is. So there's another special test that may also be done. There's another ultrasound test also, the saline infusion sonography, that may also be done. So you can see that a whole lot of tests, but all of them are not done at the same time. So, and that's why you need to make sure that you see the right person, that you don't meet a quack. If not, they may not know what to do and where to start. And you end up spending a whole lot of money Like I mentioned when we started, this is not a consultation, this is not a scientific presentation. So it doesn't replace the fact that you need to go and see your doctor for treatment. This is just for information purposes so that you understand what to do, you understand all the tests that you need to do. And if you are here and you are yet to subscribe to this channel, go ahead and do so, so that you increase the numbers and give us more reach at the same time. Now we've come to the last part. I'm still waiting for any questions. If you have questions, put it on the chat. I'll answer your questions right away. Then treatment. And this is very important. This is a very important part of this. Now the treatment depends on what the findings from the investigation. If the problem is problem of ovulation, you tackle that. If it's from the tubes, you tackle that. If it's from the man, you tackle that. But then generally, there are some lifestyle changes that may help. Remember I mentioned that drug abuse, smoking, excessive alcohol consumption, even obesity can worsen fertility problems. So lifestyle changes like maintaining normal weight through dieting, through exercise is quite important. Avoiding excessive alcohol consumption, avoiding drug and substance abuse and smoking, all these things help to improve fertility potential. Then we also consider age when treatment. So when treating couples with infertility, and usually it's the age of the woman that we consider. If a woman is older, then it's most likely that the problem may be due to ovulation. It's most likely there may be other associated problems also. And this also, you have to determine how to manage that. So now we're talking about ovulation problem. If it's due to something like polycystic ovarian syndrome, then you can use hormonal drugs to manage, some drugs to induce ovulation. You can start with the tablets. If they don't work, you can go up to the injection. You can even go up to IVF, to doing IVF. But then if the woman is older, let me assume something like 40, 45, or even older than that, ovulation induction may not work. Maybe let me take around 40, 45, or maybe if she's already in menopause, it will not work because the ovaries at that time won't respond. So usually for this group of people, that's when IVF comes in. We'll still discuss that. Why I'm mentioning this is that sometimes people with this kind of condition, maybe they'll go and meet maybe somebody who doesn't understand those principles, and they'll charge them a whole lot of money trying to give them drugs to get the ovulation to come. Now, that doesn't remove the fact that God can decide to get that done. I'm not trying to rule out the spiritual completely, but then you shouldn't subject yourself to facts who may not understand the principles of reproduction and how some of these things happen. And sometimes they give them some drugs that may even be harmful to their health. So these are medications that can improve ovulation. And for the men, sometimes you can also have some medications that can improve, some hormonal medications that can improve sperm count. But let me also point out that sometimes it's not so easy to treat low sperm count in men. Sometimes I'm not saying that it's impossible, but sometimes it may not be as easy as we think. But some hormonal, if you've done tests, maybe it shows that the hormones from the brain are low, or maybe there's a problem with the thyroid gland that is causing that. Sometimes giving them some of these hormones, deficient hormones, may help. But if the problem is coming from the testis itself, maybe because the man was born that way or it was damaged along the line, giving any form of medication will not likely help, will not help, because the problem is the problem of production right from the testis. Then for the man also, if the problem is obstruction, maybe due to blockage of the vas deferens, I've already explained what the vas deferens is. Sometimes doing a surgery may help if you can open it. Then there are also some men that maybe their reduced production maybe due to something we call varicocele. Varicocele is like there are some veins around the testes that sometimes they get like balloon, they get bigger than usual and increase in size, and then increase the temperature of the testes. Usually when the temperature is high, it may reduce production. So sometimes when those veins are removed, are tied, and sometimes some parts removed, they may help. We call it varicocelectomy. So that may also help for the men. Then if it's coming from the tube and it's blocked, most times in this modern era, what most people do is just, if both tubes are blocked, is to offer IVF. That's what most people do. But if it's only one, there's also a chance of conceiving through the other one if the other factors are normal. There's also a chance. Before now, some people used to do maybe some surgeries to correct the damage on the tube. It's also still possible to do that, but the chances of it succeeding is quite slim. And that's why now, because of the advent of IVF, some people don't bother to do it again. But these are options anyway that may be offered to you depending on where you are in the world and the resources available, the facilities available over there. Then if your doctor considers that the problem is coming from fibroid that needs to be removed, then that can also be done as well. But you have to be sure that you meet a specialist for the person to determine whether that is what should be done. Like I mentioned before, it's not always that fibroid causes infertility. It's not always. So your doctor must have to determine whether that's the cause and to do that. And if it's due to adhesions, like I mentioned, the gumming of the walls of the womb, if it is due to that, that can also be done. We call it adhesiolysis. So your doctor may also book you for a surgery to get that removed. Then if all these things have been done and you are not yet conceiving, even if it's unexplained, maybe everything has been checked, you've tried and it's not happening, the final result is to do an IVF. Now, what do we mean by IVF? What it means is that the egg is brought out from the woman and the sperm from the man, and outside, under the microscope, in the lab, those two are joined and they become what we call an embryo. Then after about 3 days, the embryo is now transferred back, 3 to 5 days anyway, to the woman. That's the simple explanation of what an IVF means. And in some cases, if it's difficult to get that egg from the woman, maybe because of age or other factors, the egg may be gotten from maybe a younger person that we call a donor. Another person will have to donate the egg to be used. And sometimes it may be from that the man doesn't have any sperm at all. There's something we call azoospermia, when there is zero sperm at all. Or maybe when it's too low and you don't even have anyone that is normal. Now, in those cases, getting sperm from a donor may also be used to do IVF, but it's not in all cases of IVF that you get from donors. There are some cases, in many cases, that you get it from both couples, get from the man, get from the woman. Now, I was thinking that this question will come up during this discussion, the issue of supplements. There are a whole lot of supplements all over the place in the pharmacy when you go to pharmacies. Now, what I will say is that scientifically, most supplements have not been tested enough to prove that they help or they do not help. Apart from folic acid, which is known to reduce the risk of having abnormal babies. So it's encouraged, women trying to get pregnant are usually encouraged to continue taking folic acid for that reason. Apart from folic acid, all the other supplements have not been proven scientifically to be of significant benefit. Let me put it this way. So, but then there are some supplements that have been researched to an extent, like something like vitamin E and C, they are antioxidants. So we believe that they can help both in sperm production and egg production. Now, these vitamins are not harmful. So There is no risk in taking them. You can even get them from the normal food and fruits and vegetables you eat. So you mustn't necessarily take them as medications. Then it's also believed that if a woman is low in vitamin D, that it may affect egg production. So that you may also take that, but like I mentioned, the only one that has been proven to be of any benefit for a woman of reproductive age is folic acid. So my advice is that you apply some caution in taking supplements. Try as much as possible to read through, try as much as possible to do your own research to know whether you should take them or not. But then, if you're in the reproductive age group trying to conceive, it will be good for you to take folic acid. So, we are concluding now. So, infertility requires patient support and proper counseling, and that's what I'm here to do today. And counseling cannot be done without the proper information. So I've given you the proper information. You now know the causes, you know how the diagnosis is made, and you know the possible treatment options. So what is left for you now, or if you have a family member, is to ask them to go and see their gynecologist and let them get assessed as a couple and also get treated at the same time. So, and they should see this as a burden for both of them, not for one partner. Remember how we started, we talked about the effects on mental health. So it shouldn't be a reason for which someone should be stigmatized, and it shouldn't be a reason for a blame game. No, but it should be carried as a collective burden by both. There is no need for shame, guilt, anxiety, and depression. And meanwhile, we know that some of these things are more common in women than in men, naturally, even in the absence of infertility. I'm talking of mental health disorder. So we should try as much as possible to make sure that the women are guarded and protected and given the best of care. And if you come across this video along the line, you come across the recording, you can share it with people who are going through this. And I mentioned that I have 2 articles, so I'll share the links now. You see it on the live. One is on causes of infertility, the other one is on diagnosis. So you can read them. They are patient education articles written for you. Okay, I just shared one. All right. So you can go through them to understand some of these things that I just said. So, and with that, you'll be able to make an informed decision. So I'm sending the second one. This one is on the diagnosis. So you've been equipped with the information you need to do the right thing, get the right information, take the right action, and don't be under pressure, because people usually take advantage of others when they notice that you're under pressure. So be calm, be calculated, be conscious of your decisions and the implications of your decisions. Be very conscious of the decision you take, especially when things are not going the way you feel they should go. So we've come to the end of the live. If you found this insightful and good, then try to like, subscribe, and share with people within your network. And make sure you turn on your notification, because soon we'll have another live. So I'm Dr. Ezike AC, signing out. Thank you. Hope